Hey, Commissioner Aguilar. I think we are
Yes,
live.
we are live. Okay, so
So
we can
this
start now, right?
we can. I just want to say thank you so much to everyone for attending our virtual HIV awareness event. I want to introduce the man who it was absolutely your idea, and you helped us to collect all these wonderful people who will be speaking today. Cook County 16th District Cook County Commissioner Frank Aguilar. Hey, Commissioner.
Thank you, Michaela, and I want to take this moment to wish you a happy birthday tomorrow. So everybody,
Hey,
happy birthday, Michaela.
thank you.
Okay, so thank you again. I also want to thank Monica Fernandez for really putting this in my attention. HIV has not gone away. It's been been around. So it's an important issue that we should address. And I'd like to thank also the Cook County, our Cook County Health, and Israel Rocha, and our health partners to really keep this issue ongoing and awareness in our community. Um, the HIV has been around for a very long time, and it really has affected a lot the LGBTQ community in the past, and it's manageable. It's not like it's not a death sentence like it was back in the 80s and the 90s. It's manageable. There's been a lot of accomplishments in the last a few years. And just because you have it, no big deal. There's help, there's counseling, and people have lived with HIV very long and healthy lives. So then again, since it affected the LGBT community, you figure, Pride Month in June will be a good point to really address the health issues that affect the LGBT community. LGBTQ, I got to get it right. So thank you again for being here. And Michaela, you can introduce our guests.
Great. And thank you for being here, Commissioner, even though you had to take this call in your car because of electrical issues at the
That's
house.
okay.
So always dedicated to the community. I appreciate it.
Absolutely.
So we're very fortunate to have our first guest. We want to make sure that everybody understands. We want to start this discussion with a real understanding of the basics of HIV/AIDS as a health concern. And we're very, very fortunate to have Dr. Pamela Vergara Rodriguez. She is a triple board certified physician in internal medicine, psychiatry, and addiction medicine with over 15 years of experience as a multi-specialty HIV provider. Who better to do this, to help us understand this? She's in Cook County Health and Hospital Systems and Director of Psychiatry at the Ruth M. Rothstein Core Center. Welcome, Dr. Vergara.
Thank you so much, Michaela and Commissioner Frank Aguilar, for spearheading this event. And thank you to everyone out there listening. You have an amazing set of speakers tonight who are going to share experiences and information to empower us all to end this epidemic. So I'm so happy to be here with you. Here to celebrate Pride Month, here to support our LGBTQ plus community, and let's just do some real talk. So let's get started on those slides. I think someone is going to pull those up. I'm not sure how I see them. Maybe someone can tell me in the chat if they're up.
They're not up yet. They'll be up in just a minute.
Great.
So Dr. Vergara, did I introduce you appropriately? Did I miss anything? I know you've done all sorts of amazing things. So
not at all. I just want to speak out to our Latino community. We have been through so much through COVID-19. And I want to let you know that HIV has not gone away. In fact, during the COVID-19 pandemic, we've had less services because people had to close down medical services. So if for any reason you are a person living with HIV right now, I want you to make sure to get online, reach out to your primary care provider, or whoever gives you services. If you're someone who's a transgender person and you have not been on your meds, call in, make an appointment, get back into care, because things are open to service you. Don't miss out on your medical care just because you're afraid of COVID. Things are safe. We're still masking inside medical clinics. We're still doing all of the right things. So don't miss out on your medical care. You need to be on your meds. Get back on your meds as soon as possible. I know we might have some technical issues, but I just want to tell you from my heart, I've been working in HIV since I was a teen and college. I've always been an advocate and ally for the LGBTQ community. And now I'm working with Illinois Unidos, which is a coalition that's working to end the COVID-19 pandemic in the Latino community. And I want to say these two things are aligned. We can end the COVID-19 pandemic. We can end the HIV epidemic too. How can we do it? We have to get tested. We have to know, do you yes or do you not? What is your status? Do you have HIV? Because if you have HIV, you can get treatment. Just like Commissioner Frank Aguilar said, we can get treatment. It's as easy as taking one medication a day. So let's go ahead and get started. Just talking about our Latinx Hispanic community. I myself am Latina. I have lots of close family members and friends that are part of the LGBTQ community. And I hope I do you all justice. Okay, let's move to the next slide. If we can, maybe not, we'll see.
We'll get there. I promise we'll get there, Dr. Vergara.
We will. And I just want to point out that nowadays you can do testing even in the comfort of your own home. You can order a saliva test. You can order it online. You don't have to necessarily go into a clinic. But also, there's HIV testing available at lots of different clinics. You can also just get it through your primary care provider. Every single lab can order a test. So if you're just going in to get blood work and you have never been tested, no problem. You just ask your doctor, hey, you know what? Can I just get that test? And they'll order it for you, no problem. And in fact, even at Cook County, if you have not ever been tested, we get a highlight that says, hey, get tested. So we think it's very important. What is HIV? Let's just start with the basics. HIV is a virus. We all know what viruses are now. We know about coronavirus for sure. It's a little bit different though. It's a virus that only infects humans. So human immunodeficiency, meaning it infects the cells the same way kind of COVID does, and then it destroys certain immune system cells. And by destroying those cells, it doesn't happen right away. It happens over time, even over years, maybe decades, where those cells go away. And as those cells go away because they're being destroyed, you can become sick and vulnerable to infections, right? You can then get infections because your immune system is low. So this virus infects the cell, reproduces, it makes babies inside that cell, and then it destroys the cell. And over time, what ends up happening is your immune system goes down. Okay, next slide, please. So HIV becomes AIDS because as the virus is replicating and over the course of many years, it destroys the immune system and makes it so that you can get infections. But what's amazing is if you test early and you know you have HIV, you can take literally one pill a day. I counted them today. We have 9 single tablets available as full 100% treatments for HIV. 9 tablets that literally you could take one pill a day for the rest of your life and live a normal lifespan, a healthy normal life, and even have children. People always ask, can I have children? Yes, you can have children. But in order for this to happen, you have to test. You have to know your status. Right? So the earlier you test, the earlier you can get on treatment and the better you'll do. But if you don't test and you wait and you get sick, which is actually what happens in our Latino population, many people are afraid of testing. So they wait to get sick. And then by the time they actually test, their immune system is too low. And that then becomes AIDS. Okay, next slide. So what about here in Chicago? What about Illinois? Unfortunately, we rank 7 out of the top 10 states of new HIV infections. So yes, our state is impacted. We're at the top, number 7 out of 50. That's high, okay? And for the Latinx community, we are 23% of the entire positive persons living with HIV are Latinx. And we're the same with the new diagnoses. This is from 2019. Okay, so we are right there on par, getting infected just as clearly, and many of these infections are in young men who have sex with men. So we need to support our community. Now, what's important to know is that in Chicago, it turns out that it might be that there are HIV strains that are more infectious, meaning more contagious, than in other areas of the United States. And that's, to a certain extent, probably why here in Chicago, the prevalence rate, meaning the number of people of Latino persons living with HIV, is much higher than compared to the national average of 277. So we're at 553 compared to 277. That's almost twice. Next slide. So when we look at the USA, this is back in 2019, we see that Latinos represented about 18% of our entire US population, but we accounted for 27% of new infections. This is not good. This is us needing to be more educated. This is us needing to do more outreach work to get people to know how to protect themselves. And if you stay on this, you're going to hear how we can do that. And in fact, 1 in 5 out of all Latinx persons are not even aware they're infected, which means, once again, get out there and get tested. If you have not been tested, get tested. Here's why. Like I said before, if you get tested early, great. You get to live a normal, healthy life taking your medication every day. But if you don't test early and you let it advance, then you get into a late diagnosis and AIDS. And right now, 23% of all the new diagnoses, 1 out of every 4, already have AIDS. That does not need to happen in today's world. We know enough. We can educate ourselves. We can work on this. Now, here in Chicago, particularly among Latinos, in general, 53% of all the new cases were among men who have sex with men. So we understand that the percentages are higher in certain populations. But we need to know that that's because we need to support our LGBTQ population to do what they need to do to protect themselves. We need to make more healthcare available to them. And we also need to know that those folks who are testing positive, the great majority, 38%, that's 40%, are between the ages of 20 and 29. This is really our young people. So we have to do something about this and get them into regular healthcare where they get their needs met. Next slide, please. Now, HIV is not the only thing that we're dealing with, right? We're also dealing with other sexually transmitted infections. There's bacterial infections and there's viral infections, and it's important for us to know that there's a difference. But it's important to know that when you get one sexually transmitted infection, you are at higher risk of getting another one. So when people test for one infection, it's a very good idea to get tested for all those infections because they are all treatable and manageable. Bacterial infections, we take antibiotics and we can cure these infections. Viral infections, we need to take antivirals, but we manage those infections. The same thing with corona. So with HIV in particular, we get tested, we get treated, we take medication, we can live well, but it won't be a cure. But we are working on the cure the same way that we're working on cures. And we found a cure, for instance, for hepatitis C. So this is something we can still do. So the thing we all need to do right now, get tested, get treated. Get tested, get treated. Next slide. So, we all have ideas about what a person with HIV might look like. They're wrong. That's just plain and simple. They're just wrong. I have patients who are my, grandma, who look like my grandma. I have patients who are super. This, whatever you think in your mind is a person living with HIV, anyone can get HIV. What we need to do to overcome this stigma is get tested regularly, talk about it regularly. We don't need to hide. We need to educate. And above all, when someone comes to us and says, I'm worried this might be the case, I'm worried I might have HIV, we need to support those people. We need to reach out and say, how can I help you? What can I do to help make the situation better? We need to group together. We've done it for COVID. We saw how strong we were. This is just one more thing. We can end this epidemic. So let's do it. Get out there, get tested, get treated. Thank you so much.
All right. You know what? I love your enthusiasm. It's infectious. I appreciate you so much for taking the time today, Dr. Vergara. If you can stick around for a little bit, we're going to introduce our next guest, but there's going to be a Q&A section later. So if you've got time, that's great. Commissioner, did you have any parting words for Dr. Vergara?
Yeah, thank you very much, Doctor, for your information. Very, very, very informative, and I hope our audience really takes note of it. Okay, thank you.
I think what that last slide was the most important. HIV doesn't look like what the stereotype is. It's anybody, it's everybody. It's young people, it's older people, it's middle-aged people. It's people rediscovering their lives after they've raised their children and they're back into the dating world. It's young people going to high school. It's everybody. So we all need to be safe and be mindful and be respectful. So thank you again, Dr. Vergara. It's very important, that presentation. Thank you so much. Okay, Commissioner, our next person that we are super lucky to have is Reina Ortiz. She is an advocate, activist, and author, fighting for the rights of the trans and gender nonconforming community. Reina works hands-on with her community, providing vital resources, and has dedicated herself to building and working with her trans community. We asked Reina to be here, and she has been super gracious and offered to share a little of her story with us, because we all know in education, while you're trying to teach people, we can give you facts and so forth, but sometimes stories are the most important. And so I'm so grateful, Reina, that you've decided to share your story with us today.
Well, thank you so much for having me. Commissioner Frank Aguilar, good to see you. I saw you in the past. You're a friend of my friend, Monica Fernandez, who is a fierce advocate here in Chicago, and also is the CEO and organizer of Twirl, Trans Women in Real Life, which is a trans group here in Chicago.
And Reina, she's the reason we're all here. She's the one who gave Commissioner Aguilar the idea that we needed to come together and address this issue. And she'll be on in a little while.
Great. So just to share a little bit of my story, I'm from Cicero. I was born in Chicago through Pilsen, and I transitioned in the 90s, in 1994. And I do have to say that, navigating through the educational system, they did not prepare me as a young gender variant youth about how high risk I was for HIV infection. I was impoverished, trans-identified, and super sexually active. And I don't believe that the systems and the school systems are giving our youth the education that they need in order to be very preventative when it comes to HIV and STI infection. My journey, like many other trans people, started with a a lot of sex work. I was a sex worker for 20 years. I like to say that my journey went from sex work to social work, because now I'm a social worker working with trans youth, and I run an organization called Task Force Prevention, where we get 60 to 80 trans and gender expansive youth a week, where we provide a multitude of resources like HIV testing and housing and legal and medical and employment resources. We're just trying to be impactful to our youth. Our biggest thing is HIV prevention. Black and brown youth, our LGBT youth, are very high risk of contracting HIV. It's almost, if it was happening to any other group, it would be like a national emergency. But since it's happening to impoverished Black and brown LGBT youth, it kind of got pushed away during COVID. COVID just kind of, like the doctor was saying earlier, people weren't able to see their doctor. They were getting off their medication. And what happens when you get off your medication, when you're HIV positive, your viral load starts to go back up. You can become medical resistant to the medication that you were taking previously. So I think COVID was a huge impact to people who are living with HIV.
And Reina, can you speak to, I think people who work a lot with the trans community and the LGBTQ community, they sort of understand the pathway that ends people up in sex work. But can you just touch base on why so often our trans youth end up in those situations?
Sure. So let's think about how they talk about the school to prison pipeline. They talk about school to prison pipeline. Well, within the trans community, from in the 80s and the 90s and the early 2000s, it was transition to sex work pipeline. Job discrimination, not feeling comfortable in these spaces, the large percentage of unemployment within Black and brown trans women. We were just very accustomed to become sex workers. And there's a lot of societal issues as well. Repression for men. Men are very repressed when it comes to openly discussing their attraction to trans women. So we're very sexualized in that aspect, and it becomes very easy for us to become sex workers. I do have to say it's diminishing as time goes on. But when I was 20 in 2000, just about everyone I knew who was trans was a sex worker or engaging in sexual activity for money. So it was just a community issue, and it was very stigmatized because we're talking about lots of different issues: transgender, sexual activity, and HIV/AIDS. So I think as we move forward as a community, the numbers of trans people in sex work are diminishing because more trans people are comfortable enough to go back to work or go to work or get jobs. So I'm very hopeful that this will be a thing of the past in my community as we continue to move forward.
Wonderful. I also, I don't know if you can speak to this. I think a large component of it was there was a lot of homelessness due to maybe rejection by your families or so forth, that sort of made you leave your house, and then you got to figure out a way to pay the bills.
It still happens. So I run my youth space on the west side of Chicago. I've been there for 7 years. And our biggest issue, besides HIV infection, is homelessness, where someone's family does not accept them. And this is deeply in Latino community, and it's also deeply better in the African American community, where families are really just throwing the kids out into the streets to fend for themselves. And if they never had a job or they're too young, 14, 15, 16, it's just really easy for them to be streamlined into sex work, where they are at risk for contracting HIV, murder and abuse, and all these other terrible disparities. So I think education within these communities, letting families know that, it's not the worst thing in the world to have a beautiful transgender youth. Just like any other youth, they need love and support and understanding. And let's give them a great opportunity to flourish in the society as opposed to just making things very complex.
And lastly, I'll ask this, and I don't know, Commissioner, if you have any additional questions, but I'll just ask this. What do you think about education in schools? I know it's very tricky talking about sex with sex in a situation where there's underage people and people of different faiths and so forth. But can you speak a little bit about what we can do to make sure that we're reaching people? Even pulling this event together, we were none of us being of the LGBTQ trans community, we had to make sure we were reaching out to bring folks together to have this conversation. What can we do to make sure that, or how do we reach those folks that you think are in danger?
Well, I think, one, the educational system, the system that we throw our children in and they navigate, it needs to be updated. And I know that there's policies that are being put in place to, really step up having conversations about sexual activity and sex. And I know Illinois is one of the few states that now is implementing LGBT history in the curriculum. And I think that's important, because if we start off with our youth being open-minded about gender identity and sexual identity, just at a small age, very light, as they grow, you can, build to more realistic issues. But I think it's important to completely dismiss this information or not acknowledgement. I think is more detrimental to our youth and the future of our youth than just slowly informing them as they go through the educational system.
Agreed. Commissioner, did you have anything you wanted to add or any questions for the wonderful Miss Reina? Oh, I think you're frozen.
It's okay. Monica Fernandez, like many other trans women, are the ones that got us to be tested. She was the first person to take me to the Core Center when I was 20 years old, and a whole bunch of other of her kids. So I'm so happy that you have a good relationship. It's important.
Thank you. I think, Commissioner, I'm not sure if, I think your connection is coming in and out. Is it me? Does he look choppy, Miss?
Yeah.
Yeah. Try again, Frank.
I know. Technology. But thank you for this, and thank you for taking the time. I really appreciate this. I think this is important for people, especially in our community, to understand. In order for us to move forward with progress, there's this hard conversations that need to be had. And then you realize that they're not that hard. They're actually really important conversations to be needed.
I'm so glad you said that. I think that is a key to this discussion. So many people, parents of young children, are always concerned. What about the children? And I'm like, just tell them. Everybody wears what they want to wear. They get to call themselves what they want to call themselves. They can be whoever they want to be. And I think it's that conversation, when you break it down in those terms, is, like you said, it's super simple. I'm glad you said that. I think that's an excellent point. Thank you so much for joining us, Reina. Commissioner, I'm sorry that if you saw your picture right now, you'd be cracking up, because it's just like you doing like different poses. It's great. Thank you, Reina. Thank you so much. Okay. I see your lips moving. Now I don't hear any sound. Oh, Commissioner. So I'm going to introduce the next guest. If you want to text me, I'll read what you want to say. I don't know if that helps. Are you on mute, maybe? No, it doesn't look like it. I can't hear anything. Okay, so I'm going to introduce the next guest, so just so we keep it moving. I'm sorry. Okay, another wonderful person that is going to be sharing their story tonight is Dee Dee, Miss Dee Dee. Hi, Miss Dee Dee. You have to unmute, my love. Will you unmute?
Hi, how's everyone doing?
Yay! So Miss Dee Dee is the youngest of 5 and was married to James Lehman for 6 years. Well, you know what? I'm not going to tell your story. You go ahead and tell your story. But I know that you've been working as an HIV tester and counselor and PrEP victor for CCHIP, correct?
Yes, ma'am. I've been doing that for about 8 years. I'm also a person infected with HIV AIDS. I received my diagnosis in 1995, so I have about 26 years being positive, and I'm also a recovering drug addict of 14 years, going on 14 years.
Wow. And can you talk to us about the time when you found out? What made you go get tested?
Back then in 1995, I was actively using drugs, so I was prostituting. And there was this little co-op from UIC. They were offering HIV testing. So just in the back of my mind said you need to be tested because I was having unprotected sex, and some of the sex acts, I wasn't using any condoms. So before the Christmas break or Christmas holiday, I decided I wanted to be tested, which was like towards the end of 1994. And then in the beginning of 1995 is when I went back for the results and they were positive. And through that course of me becoming infected, I've been in and out of prison. I've been a sex worker for many years. So this is, I'm like Rain, I'm like 48. I'm not a baby, so I'm like a veteran in this thing. So I've been around a long time, and I've dually diagnosed with HIV. Then I got hepatitis C, Hep C. I never shot up drugs, so I also contracted that sexually. So I was doing a lot of risky behaviors, and I was not using any condoms. I thought I just wanted to die, but thank God I didn't, because I had a purpose here. I was continually going, like I said, back and forth to jail. I was continuing prostituting. And 1 year, when I go to prison, I didn't take my medications because of the shame and the stigma. I didn't want to take any medication because I didn't want anyone to know that I was positive. But I told the people in intake that I was positive because the stigma in prison and jail, you don't want to be ridiculed or ostracized. So I kept that a secret. And every time I got out of jail, I would go back to using drugs. And when I went for my doctor visit, I can't remember the year or the date, they told me that my T cells has dropped below 200. And then that's when I got an AIDS diagnosis. And when I received the AIDS diagnosis, I still continued to indulge in risky behaviors. I was still a sex worker, going in and out of prison, using drugs. And I just really, at that time, I didn't care. I didn't value life. I didn't value my life, and I didn't value anyone else's, because at the time, I didn't know who gave it to me. I just know it was someone. And I didn't waste any time trying to pinpoint who it was, because I would have never known, because like I said, I was turning tricks. And most of the time, I wasn't using condoms. So there could have been any one of the tricks, or, you know. So I continued to do that for like many years. And 2007 was the last time I used, because I went to prison. And the judge told me if I came back to prison, because my charge was upgraded from a misdemeanor to a felony. They started giving me felony charges for prostitution. And not only that, they told me I would get an attempt murder because I was still prostituting and I had the virus. And I didn't disclose a lot of my johns. And sometimes I used the condom, sometimes I didn't. So that was like the last time I used, would be almost 14 years ago. And
Miss Dee Dee, congratulations on your sobriety.
thank you.
Thank you. I think that is an accomplishment all by itself. I mean, living with HIV and all the other things and where you are right now. But I just want to take a moment and say congratulations on your sobriety. That's a real big deal.
Yes, thank you. And
Absolutely.
it's thank you so much. It's hard because being part of the trans community or the LGBTQ community, it's very hard. It's very stigmatizing. And when you was asking Raina about why the youth, and I was like, the family puts them out, and they become homeless, and they're not accepted, and it was very hard. So after so long, I found a support group for people who's living with HIV, and I started going to that support group, and that's how I got involved with the advocacy, the counseling, and the testing. And about 6 years ago, um, that's when I met my spouse, who's my spouse now. He was a friend, then he became a spouse. And so it's been 6 years for us. But I can say my family dynamics, they were very supportive. And at the time I became diagnosed, it was a death sentence. People were not living long. People were scared to take, because I was part of the
It was
AZT and all that. I was on that
because
regimen.
you were diagnosed in the 80s, right?
Yeah. So
Yeah, it was absolutely at that time was an absolute
yeah.
death sentence.
So
Yeah.
That's it, yes.
so I was just pressing my way, and I had a purpose. So that's when I started getting into HIV work and helping the trans community, and just helping those, the heterosexual couples. I love doing PrEP because it's an opportunity to talk about prevention from HIV. It's hard to talk about it, and that can also be stigma because people hear about the side effects, and they go on other people's thought, and they don't like to go on and research for themselves. So that gives me an opportunity to educate them about PrEP as well. So I test, and if you're negative, then I offer PrEP to you.
Can you talk about PrEP and explain what that is? Can you explain what your options are? I know there's probably somebody who may be watching this who might think that they've had some risky behaviors. Can you just talk about what's the importance of testing? What are the options after you get tested? What are the options if you are participating in risky behavior? I know there's some preventative stuff. Can you
Yes,
just
you
talk
can.
about those things a little bit?
Yes, those preventive things is PrEP. So there's Descovy and there's Truvada. So the history on Truvada was one of the medications that was originally used for HIV treatment. So, like in 2012, the FDA approved it because a nurse, she was poked by a needle of a patient who was HIV positive. And the doctor decided to give her Truvada for 90 days. So after the 90-day stint was up, they brought her back in to be tested, and she tested negative. So then in 2012, that's when the FDA approved Truvada for prevention for PrEP. So those things would be for serodiscordant couples. That's if someone is positive and your partner is negative, they would give it to the negative partner. Then they have
And is this something you take every day? Is
you,
this something?
you will have to take it every day to get it acclimated into your system. For women, it's 20 days. And for men, it's 7. I guess because women have more things going on, and it takes longer for a woman to get it. But for MSMs, anal is 7, and women is 20. But it's a preventive measure. It's offered for only people who test negative. You have to be negative. If you're positive, it doesn't work because they only give it to negative people. So we
And so
offer
do
that.
you only have to take it for 7 days and then you're covered for how long?
No, it's
Sorry.
7 days that you take it for to get it acclimated in your system. But we actually just continue to take it till you have to talk with your doctor, and then we also still use condoms because there are other STIs that you can contract. A lot of people they take the PrEP and run with it. They're only thinking about HIV, but they're not thinking about syphilis, gonorrhea, chlamydia. So we push that also, even though we're giving you this for HIV. It's only for HIV prevention. It's not for no other STIs. So if you get a bill of health, a clean bill of health saying you're HIV negative, we still push that you use PrEP along with condoms because you can still get another STI.
And can you speak to why the importance of testing? Because people are like, if I got it, I got it. What am I going to do about it?
The importance of testing is because you don't want to infect anyone else, and you don't want to be reinfected, and you do not want to miss that window where you would never have to become AIDS diagnosed. See, that happened to me. I missed that window. I was drugging and not making my appointments, and my T cells dropped, and that's why I got that AIDS diagnosis. And I can never get another HIV diagnosis because, according to science, once you have AIDS, you have an AIDS diagnosis. So the point of testing is to do it for you, to advocate for yourself, to empower yourself, and to be able to have your own choice. Don't make no one make a choice for you. And then also to put that out there, there is PEP. PEP is post-exposure prophylaxis. So that means if you're involved in any risky behaviors, you have 72 hours to go to the emergency room and let the emergency people know that you may have been at risk. You may have been raped. You may have had a wild night, and you may have slept with somebody who was HIV positive. And if you take the PEP, it'll prevent you from getting HIV. So there is PrEP, and then there's PEP. That doesn't give you a freedom to just be wild because there's PEP. It's just another option that you have to protect yourself and your loved one. And it's important to get tested because just because you may be monogamous, you don't know what your partner may be doing. So we always emphasize that as well. Even with married couples, we emphasize that.
I think that's awesome. Commissioner, did you have any questions? Or
Yeah, can you hear me now?
I can.
Good. Ms. Didi, very good
Yes.
for your testimony. Your experience and your testimony is like saving lives right now.
Thank you.
Saving lives. That you have that's your purpose, to save lives. And you made a very important point that just because you got the PrEP medication and medications to manage HIV, that doesn't mean to be have your guard down. Just like COVID, got to make sure you get your distance, wash your hands. Same thing with HIV. You got to make sure you use protectives measures. Talk to your doctor. Talk to your I guess your pharmacist as well. But to protect yourself and your partners and your
Yes.
partner. So thank you again for your testimony. Again, your purpose is to save lives, and thank you for being here.
Thank you for having me. Thank you so much. Happy birthday to you.
Thank you so much. Thank you so much, Miss Didi. I appreciate you. Okay, so I wanna on that note, I wanna ask to speak with Anthony Guerrero. He's from the AIDS Foundation of Chicago, and I think based on the folks that we have just been talking to that were telling their stories, and I think this is, I mean, you can correct me if I'm wrong, a large population of the folks that have HIV come from communities that are vulnerable. And so there's a lot of issues there. There could be some addiction issues. There's homeless issues. There's a lot going on. And that's why I'm so glad that you're here. And I'm so glad that the AIDS Foundation of Chicago has really thought this stuff through and has developed this program called Hub, where they are catering to all of everything that each individual needs on a comprehensive level. So welcome, Anthony. And please, if you could, break it down for us and tell us what people need to know and how they can get help.
Excellent. Thank you, Michaela, and thank you to all the speakers, and thank you, Commissioner Frank Aguilar, for having me today. I'm excited to be here. So one of the things I wanted to just jump in real quick is we've been talking a lot about the importance of getting services, the importance of getting tested. Getting tested early is important to make sure that you know that you're negative when you're having sexual contact or when you're, using any sort of drug or engaging in any sex work. It's an important component of taking care of your body, knowing your status, but also knowing your status if you're positive is empowering, because that means you can take steps to take care of yourself, as Didi and Raina had both mentioned, right? These are things that they do to empower their lives. Didi had talked about PrEP and PEP. These are medication options that you can take to prevent HIV infection. PrEP is a once-a-day daily pill that you can take, and you can take it for as long as Dee Dee was saying, the 7 days is the amount of time it takes to work to become active. And then after that, you need to continuously take it like a vitamin. Pretty much, there hasn't been studies of people taking it their whole lives yet, but right now the idea is you kind of take it indefinitely to prevent HIV infection, specifically if you consider that your risk behaviors or your risk engagement or even just the life that you lead might leave you in a position that is more vulnerable to HIV. Not to really say you're risky or not. I think those labels are a little bit too judgmental. And PEP is one that can prevent if you've already been exposed. So how do you get these services? How do you get connected? How do you get testing? How do you get PrEP? How do you get PEP? And then as Michaela mentioned, and Raina had mentioned, and Dee had mentioned, these are all issues that are connected with housing, with homelessness, with emergency financial assistance. People are getting evicted left and right now. How do we make sure that people stay in their homes? People are having their lights cut off. How do we make sure that they can pay their light bill? And sometimes they have to engage in different work to ensure that they can keep their lights on. These are important things that we need to do to protect our communities. And so that's why the hub exists. So I'm just going to quickly share my screen and share screen. All right. Share.
It has a little lag, so it might take a second.
Yes. So let me know if you can see the screen of this slide in red.
You are in it. Mm-hmm.
All right. So if you are living with HIV, if you are vulnerable to HIV and looking to get on PrEP or prevent HIV, or you need any form of HIV testing, and if you need any other service related to housing, emergency financial assistance, medication support, case management, if you need food, if you need transportation to your medical appointments, if you need legal support, we can provide you referrals. If you need dental support, we can provide you referrals. The hub is designed to put all of these services into one streamlined one-stop shop. So it's while there are not specific providers for every service, we can certainly, when it comes to HIV work, we can certainly provide a lot of that in-house. And then for external referrals, we can provide you referrals to external agencies that are our partners. The best way to get, so what you'll end up doing is you'd end up calling the hub at this number here. We're soon going to be launching a website. I wish I could tease it, but I just don't want to shoot myself in the face and then shoot myself in the foot and end up having a website that isn't what I want to be showing yet. But our hub line here is a line that anyone can call, and we provide services in English and in Spanish 7 days a week from 9 a.m. to 10 p.m. on Monday through Saturday, and from 9 a.m. to 5 p.m. on Sundays. And at this hub line, there are trained experts, peers in our community who know what to do when it comes to a variety of situations, whether that's navigating how to get insurance, navigating how to get tested. Maybe you have concerns or you're scared about getting tested. They can provide you with some education. If you've recently been diagnosed with HIV and you have a lot of questions and you want to get support and you want to know what are your next steps and how do you navigate all these different things that you need to know to make sure that you take your regular medications, this is what we can help you with at the hub. And it's a centralized way to put everything into one shop to make sure that folks aren't, out on their own looking for things without any support. One of the things that I also want to share with you all, and I don't know if you can see it here, let me know, Michaela, when you can see it. It's our HIV, AIDS, and STD referral database that's used in partnership with the Center on Halsted. So the hub is a project of AIDS Foundation Chicago and Center on Halsted in collaboration. And I want to show you just some of the services specifically around HIV testing that you could seek in your community area. So let's go through this database. I literally just searched the words Illinois HIV database Center on Halsted, and it's the first link that came up. And I'm also going to populate the link in the chat. But let's say you wanted to get HIV testing. Here's this drop down here where we're going to do HIV testing. And I know that in this district we're outside of Chicago, so let's click that one. And then let's just do Cook County here. And then let's just do the west side. We can do the southwest side. Let's do the west side, and let's search what kind of HIV testing service areas are available on the west side. Hopefully, my internet pulls this up quickly enough. I have been having some struggles with my internet recently, so. Okay, there we go. So here are some locations that you can rely on for HIV testing. Now, and obviously, as you can see, these are referring to the specific. They're up to date with COVID-19 closures and stuff like that. But these are areas that you can take a look at. One that I wanted to show you specifically, that's located in Cicero, that I wanted to highlight, is the Miles Square Health Center in Cicero. Is a great place to get services, and that's a great place in the community to ensure that you get the testing services that you need. Finally,
60804, right?
60.
Yeah, that's the zip code for Cicero.
Yeah.
60804.
So let's just do that.
Maybe that will help.
Yeah, so here we go. We've got the Chicago Recovery Alliance, the Cicero Health Center, Miles Square Health Center. These are health options that can get you HIV testing in Cicero. And obviously, you can search for your own community, for your own zip code. This is a great resource for you if you're looking for things as well. You know, sometimes some folks are self-directed. Sometimes I'm going to stop sharing. Sometimes some folks are definitely trying to make sure that they can be empowered with their own answers. And we have these, these supercomputers in our hands at all times. So I want to make sure that when you are looking for services, you get connected to the hub, specifically because sometimes there's just so much to navigate. There's so many questions. There's so much to do. How do I take care of myself? How do I take care of my kid? How do I take care of my family member? All of these things are issues and questions that we're dealing with at all times. So I want to make sure that I share that information. I'm going to drop the phone number in the chat for the hub so that you can get connected, and happy to answer any questions. But thank you for having me.
That, I think, was huge. And so I'm so glad we actually took the time to go through that, because that shows how simple it is to locate that website and to navigate that website, because sometimes that can be daunting. Producer extraordinaire, Jillian, would you mind terribly having everybody join us back in this chat? I just want to see if there's any questions out there. I know I have a few questions for everybody, but I think also based on any of the conversations that we've had subsequent, that maybe we can see if anybody has any last things they want to add. Jillian, are we able to have Dr. Vergara back? And I don't know if Didi or Reina are still around.
They're currently not backstage, but I can text them to come back if you'd like.
It's okay. We can keep moving. But if they do have anything to add, or to if they want to jump back in, they can always put in any ideas that they want to talk about into our Facebook Live, or they can always text me any questions. So I think, so how, for you, Anthony, how do you reach folks? So we're having this conversation now. How do you access the folks who need you? How do you as an organization find people to help?
So we are doing a lot more outreach now than we were before. I think during the height of the pandemic, we were certainly focused in on just being present at the phones. When I tell you that we were getting calls every minute, I am not lying, because we something that's important to highlight is that the HIV Resource Hub has emergency financial assistance for people who are living with HIV, and also has emergency financial assistance for people who are on PrEP. So it became a resource for people who needed money who needed money desperately. So I think that becomes an incentive sometimes for people to call. But recently we've been doing a lot of outreach. We were just at Pride in the Park this past weekend. We're going to continue to be at events, continue to be doing outreach within the community. You're also anyone is also welcome to come to Center on Halsted. That is where a large portion of the hub operations are located. And so that is one of the main ways that we do engagement with people.
And it's also a gorgeous building, and it's also attached to Whole Foods. And they also have like a nice little cafe there if you want to hang out. It's a great space. Commissioner, did you have anything you wanted to add?
No, just thanking everybody for their testimony, for information. Is there like a website people could go to for help?
Soon there will be a website.
Okay.
I wish I had it in hands right now. When I have it, you'll be one of the first people to know.
Very good. And just want to point, I wanted to make this early when they couldn't hear me. Just we encourage the LGBTQ community and the transsexual community. There's nothing to be ashamed of, and everybody is vulnerable. Whether you're gay, whether you're straight, you're vulnerable. The HIV is a virus; it doesn't discriminate. You got to be careful out there and be very responsible. And someone mentioned about some of the discriminative attitudes towards transsexuals and in the LGBT community. We have to change some policies to treat everybody equally. The LGBT community has a lot to offer, and and we can learn from them. So I want to thank them as well, and thank my guests for putting this issue to light.
Hey, Dr. Vergara, I see you joined us back. Thank you so much. I don't know if you've been listening in, but I think lots of excellent points came up, and I would love your input on maybe some things you want to highlight, or maybe some things you want to underscore from your perspective.
Yes, I just want to say that the people here tonight represent our people. These are people who have been through so much, and we call them survivors, but really they're thriving. They're taking the best. They're taking a daisy, a weed, and making it a flower. And watching them flourish is so amazing. So please, if you're watching this page and you're feeling alone, or you're feeling like no one understands you, or you're feeling like you don't know what to do, reach out. You can see there's so many people who have been in a place where they feel lonely, they feel unheard, they feel scared. Maybe there's an issue with substances. Reach out. There are people here to hear you, to take your hand, to help you. There are places to walk in all over the cities. Walk into Center on Halsted. This is an LGBTQ-friendly place. I've been there myself many times. Walk into the Ruth M. Rothstein Core Center at 2020 West Harrison. Go into the screening clinic. Ask your questions. Don't be afraid. Just walking into a clinic doesn't mean you're accepting treatment. It just means you're there to get information. And I want to applaud these survivors, thrivers, amazing people for being here and sharing with us, because we have to do it together, right? It's the science and people who bring education, but it's our community. We need you, our community, to support our people, our LGBT population, to put aside whatever beliefs we might have about what should be or what's supposed to be we all get to now choose who we want to be. Everyone has that right. And the more we respect it, the more light we're going to bring to the table, the more light we're going to share with each other, the more connection we're going to have, and the more we'll share. So thank you so much for this invitation. And thank you, Anthony and Dee Dee and Reina, for all of you sharing tonight. It was beautiful.
I have a few more friends to introduce, but I just want to say thanks again to you all. And Dr. Vergara, you, if anybody is scared or nervous or concerned, just remember that smile. Just remember Anthony's like his beard and friendly, their beard and friendliness. Like there's so much love in this community, and even if you're not experiencing love in other places, there are places for you to go and just get the answers to the questions you needed. I think that's one of the reasons the commissioner really wanted to do this this event virtually rather than in person, just in case people needed information, but maybe they wanted to stay home and receive it or find a way to receive this information quietly. So, and just so you know, we're going to be putting all of the information and all the contact information of all of everybody who spoke previously and some more folks that I'm going to introduce onto our website. So, Anthony, when you get your new website up and running, you just send us the information and we will blast it out as much as we can.
Matter of days, potentially matter of minutes at this point that I'll be getting that website.
Super exciting. Super exciting. Okay, so we've got some more folks, but so we'll say bye to you for now, but we're going to stay in touch and we're ever so grateful that you were able to be a part. Now we're going to do our rapid fire introductions, Commissioner. Are you ready?
Yes.
All right. So we've got a number of community groups. Some people are jumping on, some people are not, but we thought it was important since you are the commissioner of the 16th district that we talk about services that are in the 16th district. Okay, so I believe we have a slide presentation that sort of will underscore some of the organizations that we have available. But I think you can even speak to this group, Alivio Medical Center. They are a wonderful partner with our office and particularly with Western Suburbs on a variety of things. I don't know if the wonderful Esther Corpus has been able to join us, but Commissioner, do you just want to say something about how long Alivio's been in the district? Uh-oh. Do you have your mute on? I can't. I think we lost your audio now. Okay. I got nothing. Nothing. I'm sorry. All right, Jillian, I'm gonna keep going, and then maybe you can check in with Frank backstage, and maybe you can hear there. But Alivio Medical Center has been an incredible partner, keeping residents healthy. They were a huge part of our trying to get people tested and treated during the corona virus pandemic. But they have been a solid part of the healthcare. I hear something.
Can you hear me now?
I can hear you now. Yay.
Okay.
Can you talk about Alivio?
Alivio's been around for a very long time. They've been servicing the Latino community in Little Village, Pilsen, and now they've been in Cicero and Berwyn, and they do service my district. So they've been, I believe, over 20 years, if not I'm mistaken, over 25 years. Maybe more specific on that. But I want to just thank Alivio for being a big part in my district to help our community.
Great. Agreed. And then we have Amita Health. I don't know if Patricia Camarena was able to join us, but Amita oversees daily operations. They have a clinical program and they have a mental health center, including training and supervision of clinical staff, student interns, program development. Oh, that's Patricia's job description. But I don't know if she's available to join us. But Amita Health is a wonderful partner in the 16th district. We also have Calor. I don't know if Alfredo was able to get on. Hey, Alfredo.
Hi, everyone. How's it going?
It's going so great. I'm so glad you're here. Can you break it down for all of our guests and tell them how Calor is helping the community?
Yes, so we're mainly in the Humboldt Park area. That's our physical location. People are always like, why are you always in Berwyn, Cicero, Southside? So our organization actually works very mobile. We noticed that even with COVID happening, we moved everywhere in the city. You know, we collaborated with organizations, and we invested into tents, into our testing van, and really became mobile because people were getting tested. We weren't getting tested last year because of COVID. So we came to their neighborhoods, we had tents. So I'm really happy to share that Calor has really strengthened our mobile testing. So you'll find us, if you're interested in testing, follow us at Calor Chicago on Instagram, and you'll see where we're going to be at. We're very mobile. Like tomorrow, we're going to be in Brighton Park in a march. Oh no, they're going to do a sit-in tomorrow for against violence in the community. So we're going to be testing there. We're at almost any event you can think of. We're probably going to be there. But one thing I'm very happy about is that we strengthened our mobile unit where we provide HIV and STIs testing, including like gonorrhea, chlamydia, syphilis, and Hep C. So we do all those tests in our mobile unit, and a client can just call our phone number and they can just book an appointment with us, and we travel to them. So they don't have to travel. If they want to be at Walmart parking lot, we go to the Walmart parking lot. If an organization wants us to test outside their facility, we bring our tent. Inside their facility, we bring our stuff. So we're very mobile. I'm excited to be changing the way we do testing, especially after COVID, after we saw that a lot of services were being brought to neighborhoods. So yeah.
I think that is spectacular. And what about like, I'm a young person, or maybe I'm a person experiencing homelessness right now. What if I don't have any money?
Our services are completely free. All of it.
Everything.
Yeah.
Do I have to have an ID, anything like that?
Nope.
I can just be like, hey, Alfredo, I wanted this test, and boom, it's done.
You can just text me, which is a good format to contact me, or call me. Both ways you can get in contact with me. And you just say, I want you to be here and these services, and we are able to provide for free. And we also do linkage to our medical facility and treatment as well, all free services as well.
Wonderful. So is the number on the screen 312-217-3823? Is that the number to your organization, or is that textable?
So you can actually text a different number. We have a mobile text number.
Okay, cool. Will you put it in the chat for me?
Yes.
And then I will make sure that it's posted on our webpage, but also on Facebook. So that's awesome. Did you have anything else you wanted to add, Alfredo?
No, just that we're typically in Cicero, Berwyn area. Just our testers just sit there sometimes a couple of days a week, and they're just doing, and if anyone's available or wants to get tested, and we also speak Spanish.
Wonderful. Commissioner, anything you want to throw in before we go on to the next one? You got to unmute. I know you're like in the car. I'm so sorry. This is
so anyway, no, it's okay. Yeah, I just want to thank all my guests that took this time out to talk about a very important health issue in our county.
We have more guests. Though.
Very good information.
We have more guests.
Oh, good. Okay.
There's more.
Right.
But say bye to Alfredo for now, because we got more people to introduce.
Alfredo, thank you very much.
Thank you so much.
And see how to Esther. Okay.
All right, great. So Casa Esperanza is a Melrose Park nonprofit focused on serving the immigrant community. So they've got wraparound services for immigrants. I'm not sure. Pablo Cruz is our contact there. Not sure if he was able to join us, but that's Casa Esperanza. And again, we're going to have all this information up on our webpage. Chicago House, which has been serving the Chicagoland area for quite some time. Oh, wait, am I out of order? Okay, we got Cook County Health next. Ooh, is Marcelino on the line? The wonderful Marcelino Garcia. One of my favorite people in the game. Anyway, oh, yay! Oh, wait, I saw him.
Hi,
Hey!
Commissioner.
How
Hola,
are you,
¿cómo
Marcelino?
estás?
How are
Hey,
you?
Michaela. How are you, Michaela? It's
I'm
great to
good.
see both of you.
It's
I
so
am.
great to see
Thank
you
you.
too. I'm,
Good to see you too.
I'm grateful we got some representation from the county. You know, our people.
Definitely.
Yes.
I'm very happy to. Can you hear me okay? I'm very happy to be here. We just a little bit about Cook County Health. We have 2 hospitals, Stroger and Provident, more than 10 health centers around the community. Actually, 2 are in the Commissioner's District. We have the North Riverside Health Center, which opened up last year. We have more than 30 exam rooms. We do mammographies. We do dental. We have social workers, we have financial counselors that can help you figure out what you qualify for in terms of ways to pay for your healthcare. If you're undocumented or you don't have access to healthcare, we can provide you with CareLink, which is our health insurance plan for Cook County Health, and you can get healthy. And that's truly one of the messages that we want to portray and give out to everyone. It doesn't matter who you are, doesn't matter your background, we're here to serve you. We have a history of over 183 years serving the communities. It doesn't matter who you are. We have people who speak Spanish, people who speak Polish and other languages. Así que llámenos. If you want to find out if you can see a doctor, you can call our patient support center, and that phone number is 312-864-0200. Our phone operators work normal working hours, and they will take your information and they will find a primary care appointment for you at a closest facility. In addition to that, the Cook County Department of Public Health is one of our entities. We have a vaccination event this weekend in the town of Berwyn to celebrate Independence Day. So if you haven't gotten vaccinated against COVID-19, I urge everyone to get vaccinated. There's no way that we can get out of this pandemic unless we all get vaccinated. I got vaccinated a long time ago. I'm still around. Look at me. It's not like I have 3 heads, 10 arms. We all know a lot of people who got vaccinated. So the best thing that we can do to protect each other, right, is to get vaccinated. If you go into our website, myshotcookcounty.org, you can find where there's vaccination events, or if you have an agency or an entity that wants to do vaccination for their community, send me a note, mgarcia6@cookcountyhealth.org, and I'll help you connect you. The core center and our wonderful Dr. Vergara is here in the community to help people who have who suffer HIV or other infectious diseases. We were there at the start of the HIV pandemic in the 80s, and we're still in the community serving everyone. Commissioner Aguilar, very happy to represent Cook County Health here. Michaela, awesome that you brought me in, invited me to join this great event. And whatever anyone needs, just please know that Cook County Health is part of the community and we're here to help. Provide resources and do whatever we can to make sure that everyone's healthcare is taken care of.
Cook County representing.
Yes.
I love it. Commissioner, anything to add?
Good. Oh, and you know what? Not yet, but I forgot to tell everyone about the Morton East Health Center, which helps adolescents basically at the school. But right now, it's actually a vaccination site. So you can always go to Morton East Monday through Friday, 8 to 6, and get vaccinated over there. So thank you both.
Very good. Yeah. And I'd like to thank also, President Perkwinkle and especially and my colleague, Commissioner Alma Anaya, that we and Commissioner Larry Sufferland, who helped me last year to keep it open, because it was
No, definitely.
an interesting, in closing and transferring it over, but they kept it open. A very important clinic in our community, and I'm glad it's still around.
Yes, and we're proud to serve everyone in your district.
And
So thank you.
we're glad you're around.
Thank you.
You're one of my favorite people at Cook County Health.
Thank you.
Thank you so much, Marcelino.
Okay.
We'll check in with you soon, and we're going to put up, again, all of the information is going to go up on our webpage. Thank you so much. Okay, we also have, there's always the Cook County Department of Public Health. I'm not sure if Stacy Ravenesi, hey, she made it. How are you, Stacy? Public health educator checking in for Cook County Department of Public Health.
Yes, hi. Thank you for having me. Marcelino, thank you for the shout out to the health department. We are part of the Cook County Health. We service the entire 125 municipalities in suburban Cook County, so a very large area. There are many sites throughout suburban Cook County, but it does not include Chicago, Evanston, Oak Park, Skokie, Stickney. They all have their own separate health departments. Specifically for HIV and STI, we do data collection, data analysis, counseling, education, referrals, linkage to care. And our biggest program is our syphilis and HIV partner services, which includes partner notification. Much like COVID and contact tracing, we've been doing partner services, partner notification, and referrals for other diseases, including syphilis and HIV, for as long as I can remember, 30 plus years. So COVID just kind of changed us a little bit into a new disease to focus on, but we are thankfully back full steam ahead, actually hired a few new people, and we are doing syphilis and HIV partner services in both English and Spanish throughout the entire suburban Cook County area.
That's wonderful. And if people, I think we've got your website up there,
Yep.
cookcountypublichealth.org, if folks want additional information.
Yes, our website it's very large, it's very complicated, and right now is very heavy on vaccine focus, which we understand why. So if people have any direct questions in the, kind of the near future, best way is to reach me on my cell phone number, and I will point them in the right direction.
That's so great. We're going to put that information up and out there for everyone. Stacy, I think it's so important to have it, like a phone number where a person answers the phone.
Yeah, I'll answer.
Like it sounds like not a lot to ask, but it really is. So I appreciate that, Stacy.
Yes, you're welcome. And I don't speak Spanish, but I can get a hold of a couple of my coworkers very quickly. So we'll point people in the right direction.
I know how to say, I can speak a little bit, but I know how to say espera un momento.
Yeah,
so
me
that,
too.
Just wait a minute so I can find somebody else.
Right. Like, me too.
Sorry, Commissioner, were you saying something? I thought I saw you unmute for a second.
No, I just want to thank Cook County Health, and Israel Rocha, our CEO, and Dr. Yoshi and Dr. Rubens, their commitment in addressing an issue like HIV. Thank you for them for participating in this event.
Yes.
Thanks so much, Stacy.
Thank you,
All
guys.
right. This is our rapid fire. These
Stacey.
are all the services. We also have Cook County Health Prep Connect. Vidal Febles, from who is a Westside Prep coordinator. Hi, Vidal.
Hi, Michaela. Hi, Commissioner. How are you guys?
Great.
So, yes, Prep Connect is the leg of prevention of my organization. My organization is called Cook County HIV Integrated Programs, CHIP, so everybody can know it. At CHIP, we offer patient-centered medical home to the west and south side of Chicago and suburban Cook County, okay? We offer a holistic approach to ensure that individual care and total well-being of our patients. Also, besides HIV services and PrEP, we also offer STI screening and treatment. We offer PrEP for HIV prevention. We also offer hepatitis B and C treatment. and general infectious disease care. For people living with HIV, we offer specialty services like behavioral health. We offer case management. We offer early intervention services. We offer support groups. We offer outpatient substance abuse outreach. We offer oral health and medication assistance program. So if you don't have, let's say you don't have insurance, or you're undocumented and you don't have papers, we can help you get the services that you need. Either it's prevention for HIV or treatment for HIV. Okay, we have 4 main locations, 2 on the west side of the city and 2 on the south side of the city. On the west side, we have the Ruth Rothstein Core Center that is located on 2020 West Harrison Street. Also, we have the Austin CBC that is located on the 4800 West Chicago Avenue. Under the Austin umbrella, we have Jorge Prieto in La Villita. We offer PrEP services over there. And also in the Commissioner District, we have North Riverside Clinic. We also offer PrEP services over there. In the South Region clinics, we have our biggest one, that is the Providence Hospital, that is located in East 51st Street on Chicago on the south side. And also the South Suburban HIV/AIDS regional clinics. That's composed of Blue Island Health Center, Robbins Health Center, Cottage Grove Health Center, and yeah, that's about it. So if you want to get tested for HIV, PrEP services, or transfer your HIV services to us, please call us 312-572-4500.
Wonderful. We'll put that information in the chat. And Vidal, I want to just underscore that it sounds like you also have a lot of wraparound services, mental health services, and when you said group
yes,
therapy as well. That's
support.
Huge.
Yeah, we offer support for people who are living with HIV. I know a really big important part of treatment for HIV is having people who are living what you're living, so that way it's easier for you to overcome this.
I think that's huge. And do you have those meetings in English and Spanish? Or?
Yes, we speak English and Spanish.
Okay, that's awesome. Any questions, Commissioner?
No, how can they contact you?
Yes, they can contact me to the number 312-572-4500. You can call there and they're going to guide you either for HIV prevention, STI screening, or HIV testing and HIV treatment.
Wonderful.
Do you have a website as well?
Say that again?
A website.
Oh, a website. We're working on it soon.
Okay.
Wonderful. Thank you so much, Vidal. I appreciate you. All right. Next, we have Vanessa Melgosa, my new best friend. She has been amazing helping us pull this event together from Corazon Community Services. I'll let her introduce herself. And she's going to be the star of tomorrow's show because I will be having my birthday and I will not be talking about anything that has to do with my actual job. And so the beautiful Vanessa has offered to take over for me tomorrow.
Thank you so much. Hello, everyone. My name is Vanessa. I'm the Director of Health Services here at Corazon Community Services. We're located in Cicero. We've been here since 2003. We are a nonprofit organization. We offer free and confidential HIV and STD testing for those who are 12 years and older. So we do mobile testing. We go out to events, motels, wherever, the community needs us. We do a lot of referrals. So we link people to care, to treatment. We refer people for mental health, employment, other services. Something that we also provide is free sex kits that contain condoms, lubricant, and other free giveaways. And we just offer a safe place here in our facility to empower and educate our community. That's the only way we could do this, to unite together, to educate and empower each other and share resources. So for more information, we're here Monday through Friday from 9 a.m. to 7 p.m. Those are our summer hours. You could call us at 708-656-1400. You could ask for myself, Vanessa. We have very friendly staff. We speak English and Spanish, so feel free to get connected with us. You could also look us up in our website at www.corazoncs.org. Thank you so much.
Thank you, Vanessa.
All right, we're going to see you tomorrow. Well, everybody else is going to see you tomorrow. I will not see you tomorrow. I will be sitting on someone's patio.
I want to thank you in advance, Vanessa, for tomorrow.
Yeah, I'm thanking you in advance. I'll be on someone's patio sipping cocktails. Okay, so thank you so much. We'll talk to you tomorrow. We have somebody mentioned it already. The Morton East High School clinic. They're here to help. And Dr. Truesdale, hey, I'm so glad you're here. He's school superintendent. Can you go ahead and share a little bit about what's going on in your district? Wait, I think you're still on mute though.
Dr. Truesdale, thank you for being here.
Sure, you're welcome. Thank you for having me. Just would like to say a little bit about how we provide services to our students. So I'll mention the clinic in just a minute, but first of all, it's striving every day to be welcoming and inclusive of all students at Morton through programs to work with students on social emotional learning, executive functioning, to services to our social workers and psychologists, and just having inclusive practices for all of our students. So that's kind of the foundation. We actually work with Corazon as another arm of our services to students. They do a lot of work with our students on sexual health. So that's a partnership that we do appreciate. The clinic, as Commissioner Aguilar said, we did a lot of work last summer to ensure that the services at the clinic actually improved, as there was some discussion about transitioning the management of the clinic at East. And so we've actually increased services to our students and their families over the past year. And when it comes to HIV and related services, we do provide testing through the clinic. Students get referrals for medical care for everything under the sun, including STIs and specifically HIV. So that's available. The clinic also provides counseling services for students. And as was mentioned earlier, right now we're a COVID vaccination site. And so we're proud of the fact that we've administered over 16,000 doses of COVID vaccine since early February, not just for Morton students and staff and their families, but for other communities, for educators that needed to get staffs vaccinated in order to get kids back in school. In addition to the clinic, another service that we provide for our students we have a children's center on campus at Morton East that provides child care services for our students who are parents, and all the supportive services and parent education programs that go along with that. So those are programs that are more targeted, obviously being in a school toward our students in particular, but it's just appreciated to have the opportunity to communicate with everyone the things that we do have available for the kids at Morton East High School. So thank you.
Thank you so much, Dr. Truesdale.
Thank you, Dr. Truesdale. Thank you.
Awesome. All right, we're going to keep moving. So next, we have we want to do a shout out for the Proviso East School-Based Health Center, which also hosts the Loyola School of Nursing. They were really helpful as we were pulling this together, and they have additional services. Rincon Family Services. I don't know if Anna's here, but hey, Anna. She has been a friend to the office.
How are you, Anna?
Since we got here.
Thank you for being here.
Right? Everybody loves Anna.
Yes. So, how are you guys?
Real quick, because this is our lightning round, and I'm already over time. Will you share with us all the wonderful things Rincon does?
Yes, so we're also a non-for-profit organization, and we've been around for 49 years. And the organization has grown within the last few years, and we've shifted to provide more holistic services to the families. And how do we serve the community with this topic on HIV awareness? Right now, we primarily serve the high-risk population of substance users, like Dee Dee mentioned. It is a high-risk behavior, so anything from opiate use to alcohol use to any other drug use. It is a high risk behavior that does put us in a vulnerable position to contract not only HIV, but any other sexually transmitted infections. So we do serve the community by offering HIV testing and Hep C testing. So we do have that, and we also have had sex education and also free condoms and lubricants, as Vanessa mentioned earlier. So it's more of, again, educating our community. This cannot be a taboo topic anymore. We cannot continue to live in that fear of what is my family going to say or what is people going to say. It's more about bringing this education back and making sure that they understand the importance of preventive measures to not contract and not be a risk to someone else.
And I know you will knock on doors. You will set up in a parking lot. You will go anywhere to get people the information that they need, even if they don't know they need it. Exactly. You're going to find them.
And this is what kind of stands us out from others. We will meet people where they are, right? This is how dedicated we are to helping out the community. So rain, shine, snow, cold, we will be there, right? And I know Commissioner Frank can attest to that because he met us up at one of the events where it was below zero and snowing, and we were still there.
You could say that again, Anna. You could say it again. You were there. Real troopers in the blizzards and the below zero weather. We were there fighting COVID. So kudos to you and Rincon.
Yeah,
thank you.
Rincon and your team is right up the commissioner's alley because he's the same guy. He puts on his winter coat and he'll be out in the community come rain or come shine. And so you were like one of our first partners when we were really trying to jump in with both feet on the COVID-19 situation, and a perfect partner for the commissioner.
Yeah, no, and thank you for allowing us to be a part of this opportunity. And we look forward to working in partnership with you guys for any future projects. And you can definitely count on us.
And you can't get rid of us.
Thank you, Rico.
Right.
We're going to be calling you no matter what. We know you deliver too. Okay, wonderful. Thank you, Anna. All right, so there's also SGA Youth and Family Services. Juan Matus has been incredibly helpful. We talked to him this week, and so we've connected with them too. We also have Task Force Prevention and Community Services. We talked to Reina. Oh, there's Reina. You came back. Hi, my love. Do you want to shout out your group real quick? I think you did earlier, but do you want to shout it out?
I will again. If you are trans, gender nonconforming, gender expansive, looking for a space on the west side of Chicago to be supportive of you, we are 9 North Cicero Avenue. Mondays and Wednesdays, we have a youth space. We're open from 3 to 9. We service, between 60 to 80 youth a week. Housing, medical, legal, name change, gender marker change, job skills, all those things. So if there's any trans or gender nonconforming people on the west side looking for a space that is affirming, supportive, and loving, please come to Task Force Prevention.
Wonderful. Thank you so much, Reina.
Thank you, Reina.
Wow, this is great.
We're staying in touch with you too. We appreciate you so much. See you tomorrow.
Very good. I also want to mention Juan Matos because Juan, is Juan there? Juan?
No, he didn't. He couldn't make it. They couldn't make it.
Juan Matos and Rincon. We also, I think about maybe a little over about a year ago, maybe less. We talked about also HIV, and then Monica Fernandez. I want to thank her again. She's really making it happen and really putting a spotlight on it.
So Monica is with us right now. Monica, you got to unmute. Monica, just real quick before you start talking, I just want to say Monica is the reason we're all here. Monica brought this issue to the commissioner, and Commissioner, you can introduce her.
Monica, how long have I known you? Like Fernandez for like a long time, right?
Yeah.
Little Village, Little Chamber of Commerce. Your salon there. So you're a great friend, a great advocate, especially for the LGBTV community and the transx. You've been outspoken and you're very courageous, and I admire that in you. You're not afraid to tackle problems. You grab the bull by the horns and take it down. He says, Frank, let's do something about HIV. It's plaguing our community. let's do something. I go, let's put our sleeves together and let's go for it. So thank you, Monica. Thank you for
Right,
doing this.
Commissioner, for the opportunity, because that's what we're seeking and that's what we're lacking. Opportunity. The trans community is lacking opportunity, and you're gonna make it happen. And Michaela, thank you also, because we are seeking opportunity. The trans community. Yesterday, I was in a conference with the city of Chicago, and they told me that they were not aware of what the trans community is going through, And I'm like, don't you have all these programs for the trans community? So where are the resources going to? Because they're telling me that they're not aware. How can you not be aware what the trans community is going through, And now, from this day forward, I'm seeking, and I'm announcing awareness, trans awareness, and unity in the
Great.
community and opportunity. That's what
Excellent.
I want.
Great.
Unity in the community and opportunity. That's what's up.
That's what
That's
it,
great.
Michaela, that's what we're lacking. This is what the trans community is lacking. And we have not we haven't gotten an opportunity to prove to everyone and the community that we could be like everyone else. We're looking for equality and opportunity to grow in the community, so we could pay taxes, so we could uh, buy cars, so we could be productive, you know we
Amen.
that opportunity, Michaela, and
I
we're gonna work with you all.
Yes, we are going to stay in touch, and thank you again. This is all you, babe. This is what you've done already. There's at least 15 different organizations, I
And
think,
also,
that are going to share all this information. Just this is all from you. So
so don't forget that we still, like, we had this pandemic. We forgot about the other pandemic that hit us in the 80s, which was HIV. And I think we need to don't forget about this disease, this virus, because it's out there still. We need to still promote awareness of HIV and STI, especially because this pandemic hit us hard, not
yeah.
only with HIV but with STIs.
And don't forget to hear me when I'm saying how wonderful you are.
Thank
You've been excellent. You've been a wonderful partner. The commissioner speaks so highly of you.
I'm Michaela. Let me announce this, that me and the commissioner are working on a project. I'm starting Twirl,
Yeah.
which is it abbreviates trans women in real life, and
I
this
love it.
this is going to be a new organization for the Mexican community and trans community. Don't forget that,
Great.
because
We're waiting to hear more wonderful things from you really soon. Thank you for everything, Monica.
welcome.
Monica, thank you. It's a really pleasure knowing you and being my friend, being your friend.
Thank you, Commissioner, that you call me your friend. Thank you so much, and thank you, Michaela, for
Absolutely.
having us here, and all the organizations. I thank you from the bottom of my heart.
Thank you,
Thank you. Thank you
Monica.
again,
And
Monica, for your guidance in educating our community and letting me know how we can help the trans
We need
community.
to educate the youth. We need to make them aware that there is something out there that you could, you know, come in contact with, and it's like it's dangerous and it's not good, for you. We need to seek awareness.
yeah, it'll change your life. On that note, I think we're out of we're out of groups. Oh, youth, YOS Youth Outreach Services. I don't think we have. I don't think Felicia was able to make it.
Tell you something, Michaela. So everybody was talking about it. Like, what was his name from Howard Brown? He mentioned that, okay, he had the zip code, but these organizations came up, but were they LGBT friendly? That's what I want to know, because that's what we're seeking in Cicero, you know, there's nothing LGBT, and we need to bring it to Cicero. You know, why do the children have to travel so far to the center on Halsted? You know,
Oh, so that website, actually, you put whatever zip code you want to in, and they are LGBTQIA friendly, and you will be connected with an individual. So it's a great resource, but we can't wait to add your information to that website so that people can reach out and you can help folks as well, more than you already have. But I know we're out of time, so I gotta wrap it up, Monica.
So much. Thank all the organizations. Thank you, Commissioner. And
thank you, Monica.
We'll meet again.
Thank you so much. All right, Frank, we're way over time. But
we're over time, but
I know this was important to you. Your amazing staff and Cecilia wasn't able to join us, but Cecilia Salinas, our community outreach director, worked her butt off for weeks pulling this amazing cast of really dedicated community folks together. So I want to shout her out before we wrap up. But would you like
thank
to
you.
close
I got a great staff. Michaela, thank you very much. Jillian De Leon, my deputy chief, thank you, and Tanisha Shelby Woodson Shelby, and Cecilia Salinas. I got a great staff that really puts everything together and makes me look very good. Just to bring forward the programs and the information that we have to share with our community. So we can have another one in Spanish. We usually have this third and fourth Wednesday of the month, our Facebook Live, and talk about issues, but we are going to have two, one in English today and then one in Spanish, because this was a very important issue that we have to talk about, a health issue, and we want to make sure that we get the word out. So again, thank you for being in, and we will see you tomorrow. Mañana.
Everyone tomorrow. Except for me.
Except for you. Enjoy your birthday, Michaela. Enjoy your birthday.
Thank you.
Okay.
Thank you. All right. Bye.